Okay, so I am going over oral cares for mechanically ventilated patients. We do this about every 2 hours to prevent ventilator-associated pneumonia. This is to just keep the patient's mouth clean and get rid of any secretions that have kind of built up in their mouth that they can't just cough up on their own or spit out on their own because they are on the ventilator and most likely sedated. And can't do that on their own. So first thing that I'll do, I'll enter the patient's room, wash my hands, put on gloves, and then I'll pull out my first kit, and it's this prep pack, and it has all of my suction pieces. So it has this Y piece, so I can have two sets of suction tubing kind of going at the same time. This little piece with the on and off switch that connects to my suction tubing, and then all of my pieces will hook onto the top of this. So this is this nice little suction. I can use to suction out my patient's mouth and then pull this back up, and then that way it's not just laying in the patient's bed getting dirty and then we're sticking it back in their mouth. This kind of bag and plastic piece over it just kind of makes sure that it keeps it a little bit more clean for the patient. So of course the first thing that I'll do is suction out my patient really good, get rid of anything that's kind of been sitting in their mouth, and then I'll grab my first kit. And the first one that I have here has this nice little toothbrush in it and some toothpaste, so I'll dip this in here, brush my patient's teeth, making sure I'm getting their molars, top, bottom, left, right, kind of in a back side of their teeth, front side of their teeth, going in nice small little circles, gently, gently getting the gums, getting their tongue and the inside of their cheeks. And then you can switch on this suction and run the suction through it, which is really nice. And then I can throw that away. And then the next thing that I'll do is I have this nice little green swab and this mouth moisturizer. So I'll squirt this all over and then go through and get the inside of my patient's cheeks and their gums and their tongue, just making sure that we're keeping their mouth nice and moisturized and it's not getting too dry. So then I'll wait 2 hours and come back, see my other patients, and come back in 2 hours. And the next thing that I have is this nice long suction catheter. So again, I'd start with this one, suction out my patient's mouth, and then I can pop that off and I can put this one on. This one I can go a little bit further deeper into my patient's mouth than I can with this. I can kind of start to go down their throat. I can suction on either side of the ET tube and get any secretions that might be building up back in there, anything in their mouth like that we want to make sure that we're suctioning and getting rid of. And again, use this one, get anything out of their mouth. See my other patients, come back in 2 hours, and then the next thing I have is this little green sponge that I can hook up to my suction. Dip it in this kind of like toothpaste type solution, like toothpaste mouthwash. Again, clean the inside of my patient's mouth, their cheeks, their gums, their tongue. Flip the suction on, suction while I'm doing it if I need to. I can always trade it out, put this on again, suction up really good again, and then always want to make sure, dropping stuff, always want to make sure, again, I'm using this mouth moisturizer, putting it all over the sponge and going all over my patient's cheeks, making sure that we're keeping that nice and clean and nice and moisturized.